Okay, welcome to the deep dive. Today we're diving deep into your sources, the articles and research you've shared with us, to explore a really serious topic in pet health.
Acute kidney injury.
Right, AKI. Also known as acute renal failure.
Yeah, it's a critical condition, comes on fast, and can be really life-threatening for both dogs and cats.
Exactly. So our mission here is to take the key info from this material you sent and, break it down for you.
Help you understand what AKI actually is.
Yeah, and the range of things that cause it some are quite surprising. How vets figure it out and why acting fast is just so crucial.
It's definitely complex, but these sources give us some really vital insights.
So let's jump right in. What actually is acute kidney injury? The sources define it pretty clearly.
They do. Basically, it's a sudden failure of the kidneys to do their main job, which is filtering waste from the blood.
So things build up.
Right. You get this rapid accumulation of toxic stuff, uremic toxins are often called, or azotemia, and it just throws everything off balance. Fluids, electrolytes like potassium, acid levels, it all goes haywire.
And you said sudden. That's the key difference.
Absolutely critical. That's the defining thing. We're talking hours to maybe a few days.
Not like chronic kidney disease.
Exactly. CKD is that slow, gradual decline, over months or years. AKI is, bam, an emergency.
And the sources confirm, unfortunately, it's risky, high mortality rates mentioned.
Yes, it's very serious. But, and this is a really crucial point from the material, unlike CKD, which is generally downhill,
AKI might be fixable?
potentially yes. If you catch the cause quickly and treat it really aggressively, the kidneys sometimes have this amazing ability to repair themselves and get back some function. That's a huge takeaway.
Okay, so let's get into the how. How does this damage actually happen inside the kidney? What mechanisms do the sources talk about?
Well, basically, some kind of severe insult hits the kidneys and stops them filtering blood properly. The damage can affect different parts, like the tiny filters, the glomeruli, or the tubules where urine gets processed.
Or even the tissue between them.
Right, the interstitium. Or sometimes it's simply that not enough blood is getting to the kidneys in the first place.
Let's start there. The reduced blood flow, that's ischemic AKI.
Correct. Ischemic means lack of blood supply or hypoperfusion. Think about things like severe dehydration, maybe shock from trauma or a bad infection.
Even low blood pressure during surgery.
Yeah, that too. When that blood flow drops way down, the kidney cells, especially in those busy tubules, they don't get enough oxygen. They get starved.
And they start to die off.
Exactly.
Yeah.
They get cell injury or death necrosis or apoptosis. And then dead cells can actually clog up the tiny tubules. Plus, the damaged tubules can leak the fluid that was filtered back out.
So filtration just grinds to a halt.
Pretty much. And what's really tricky, sometimes the kidney's own response to low blood flow actually causes blood vessels to clamp down even more, making the ischemia worse.
Wow, okay, that's a nasty feedback loop. Now, the sources also really highlight toxins, nephrotoxic AKI.
Yes, direct poisoning of the kidney cells. And the sources list some really important and sadly quite common ones for pets.
Like antifreeze, ethylene glycol.
The absolute classic, unfortunately.
Yeah.
The body breaks it down into substances that form sharp crystals.
Oh, actual crystals.
Yeah, calcium oxalate crystals that physically shred and block the kidney tubules. It's incredibly damaging.
And for cats, specifically lilies, the sources were very clear on that.
So important for cat owners listening. Lilies are highly toxic to cats. Just a bit of pollen, chewing a leaf, even drinking the vase water.
That's enough.
It can be enough to cause severe, often irreversible kidney tubule damage. Deadly serious.
Grapes and raisins in dogs were also mentioned. That surprises a lot of people.
It does. The sources call it an idiosyncratic reaction, meaning we don't really know why it hits some dogs so hard and not others, but it's definitely a known cause of AKI.
What about medications? Things vets might prescribe or even over-the-counter stuff?
Yes, certain drugs, some antibiotics, like the aminoglycoside family gentamicin, is one can damage tubular cells.
Then common painkillers. NSAIDs.
Right. NSAIDs can be risky, especially if the pet is already dehydrated or has low blood pressure. They can make blood vessels in the kidney constrict, cutting down blood flow.
Kind of like that ischemic injury again?
Exactly. It can be a double hit.
Mm-hmm.
The sources also mention things like heavy metals, certain cancer drugs, and even some rat poisons containing vitamin D.
Vitamin D, how does that cause it?
Those cause dangerously high calcium levels in the blood, hypercalcemia, and that itself is damaging to the kidneys.
Okay, so poisons are a huge category. What about the body attacking the kidney? Inflammation.
Yeah, that's the inflammatory or immune-mediated type. The kidney tissue itself gets inflamed. It could be the filters, glomerulonephritis, or the tissue in between interstitial nephritis.
Triggered by what?
Infections are a big one. Leptospirosis is a major cause in dogs, often hits the liver too. Lyme disease, urolicia, or sometimes it's the pet's own immune system going haywire.
The sources also briefly mention stages: initiation, maintenance.
Yeah, initiation, extension, maintenance, recovery. They're not always clear-cut phases in a real case, but the idea is there's an initial hit, then the damage spreads. The maintenance phase is usually when the pet looks sickest because the damage is done and the kidneys aren't working.
And recovery, if it happens.
Can be slow, weeks, even months. And, importantly, the sources stress that some permanent scarring or damage might be left behind, even if they seem okay later.
All right, so we've got the how lack of blood or direct damage. Let's look at the specific causes. The sources group these pretty neatly.
They do, based on where the problem originates relative to the kidney. First up is prerenal azotemia.
Meaning before the kidney.
Exactly. The problem isn't the kidney tissue itself initially. It's that something is stopping enough blood from getting to the kidney.
Like that severe dehydration we talked about.
Perfect example. Or shock, bad heart failure, really low blood pressure, some drugs, or that high calcium causing blood vessels to clamp down. The kidney wants to work, it just isn't getting the supply.
But if that goes on too long,
then you damage the kidney tissue itself. The crucial point is, prolonged prerenal problems will lead to actual kidney damage, turning into the next category.
which is renal or intrinsic azotemia, damage in the kidney.
Right. This is where all those direct causes fit. The toxins, antifreeze, lilies, grapes, meds.
Infections like lepto.
Yep. Leptospirosis is a key example of intrinsic AKI in dogs. Also, kidney infections, pyelonephritis, the damage from prolonged lack of blood flow, immune diseases, direct trauma, even tumors growing inside the kidney.
Okay, and the last one, postrenal azotemia.
Problem after the kidney. Something is blocking the urine from getting out.
Like a plumbing backup.
Exactly like that. The urine backs up, creates pressure, and that pressure physically damages the kidneys upstream if it's not relieved quickly.
What usually causes the blockage?
Urethral obstruction is a big one, super common in male cats, usually from tiny stones or mucus plugs. But it can also be strictures, tumors. Or the blockage could be higher up in the ureters, the tubes from kidney to bladder, often from stones there too.
Got it. And figuring out which of those three, prerenal, renal, postrenal, must be step one for treatment. So if your pet develops AKI, what might you actually see? What signs do the sources mention?
Well, often it's quite sudden, and the signs can be vague at first. Just, not eating, acting really tired or depressed.
Lethargic.
Right. Vomiting is common, maybe with blood. Diarrhea, sometimes also bloody. You might notice really bad breath, that sort of ammonia smell, uremic breath.
What about more severe signs?
If things are really bad, you could see neurological issues. Wobbliness, unsteadiness, ataxia, or even seizures. That's usually from the toxin buildup hitting the brain, or severe electrolyte shifts.
And knowing about toxin exposure is obviously key history.
Huge red flag, yes. If you know they ate something suspect, tell the vet immediately.
What about urination? Seems like that would change dramatically.
It often does, but it can be tricky. You might see oliguria that's way less urine than normal, or even anuria, no urine output at all. Those are pretty clear signs the kidneys aren't making urine.
Oh wait, the sources mentioned something confusing. Paradoxical polyuria. Peeing more.
Yes, this is such an important point from the sources and easy to misunderstand. Polyuria means lots of urine. Paradoxical polyuria is when a pet with severe AKI is producing a lot of urine.
How can that be bad?
Because the quality is terrible. The damaged kidney tubules have lost the ability to concentrate the urine, so they're just dumping out large volumes of very dilute fluid that isn't actually clearing waste products effectively.
So lots of pee doesn't automatically mean the kidneys are okay.
Absolutely not. It can actually mean they're severely damaged in a specific way.
Right.
It's a crucial thing for owners and vets to recognize.
Wow. Okay, what might a vet find on their physical exam?
Well, signs of dehydration are common. They might see ulcers in the mouth. Palpating the kidneys, they might feel normal or maybe enlarged, painful, firm.
Any specific clues?
A big one for obstruction is if the vet can't feel the bladder or it feels tiny in an animal that should have needed to pee. That points strongly towards a blockage. And the source is specifically mentioned in cats. If one kidney feels bigger than the other, or they feel painful or firm, that can also suggest either intrinsic damage or an obstruction.
Okay, so you've got the signs you suspect AKI. How do vets actually confirm it and figure out the cause? It sounds like putting pieces together.
It really is detective work. First step, getting really detailed history from you, the owner,
Mm.
any chance of toxins, recent sickness, travel, any surgeries, and crucially, any changes in urination, amount, frequency, straining.
Then the physical exam adds more clues, like kidney palpation.
Exactly. Checking hydration, feeling those kidneys carefully size, pain, symmetry, remembering that asymmetry in cats, checking the bladder size.
And then the lab work, that's the core, right?
Absolutely. Blood tests are essential. A CBC complete blood count gives an overview, maybe anemia if there's chronic disease lurking or signs of infection in the white blood cells. But the biochemistry panel is where the action is for diagnosis.
Looking for those waste products.
Right. You're looking for progressive increases in BUN blood urea, nitrogen, and creatinine. Those are the key markers of kidney filtration failure. Phosphorus usually goes up too.
And electrolytes.
Critically important and often abnormal. High potassium hyperkalemia is the big emergency. It can literally stop the heart. Low bicarbonate indicates metabolic acidosis. The blood is too acidic. Calcium can be high or low. Sometimes high calcium is the cause of the AKI.
Now, urinalysis. The source has really hammered home the importance of urine-specific gravity USG. What's that telling the vet?
USG measures urine concentration, how much stuff is dissolved in it compared to pure water. It's a direct measure of how well the kidney tubules are doing their job of concentrating urine when the body needs to conserve water.
And how does that help differentiate the types of AKI?
Okay, think back. Prerenal low blood flow, maybe dehydration. The kidney itself is trying to work, so it makes concentrated urine to save water. USG will be high.
Makes sense.
But with intrinsic AKI, the kidney tissue is broken. It can't concentrate urine, even if the animal is dehydrated. So you see azotemia, those high waste product levels in the blood, along with inappropriately dilute urine.
What counts as dilute?
Often it's isothenuric, meaning the same concentration as blood plasma,
Yeah.
roughly 1.008 to 1.012, or maybe minimally concentrated, like 1.01 to 1.025. Finding that combination azotemia plus dilute urine is a really strong sign of intrinsic kidney damage.
But there was a nuance for cats.
Yes, good point from the sources.
Mm.
In very early AKI, or if a cat is also super dehydrated, their USG might still be high initially. So while low USG with azotemia screams intrinsic AKI, a high USG doesn't totally rule it out, especially early on in cats. You have to look at the whole picture.
What else is checked in the urine sample?
The sediment, what settles out when you spin it down. They look under a microscope for cast little plugs of cells or debris from damaged tubules. Renal tubular cells themselves shedding. Specific crystals, like those oxalate ones in antifreeze poisoning, or signs of infection bacteria, white blood cells.
And if you suspect something specific, like lepto,
Then you run specific tests for it, yeah. Or there are quick tests for ethylene glycol, or checking serum osmolality can give clues about certain toxins.
what about imaging? X-rays, ultrasound?
They're really helpful. X-rays show overall kidney size, usually normal to big in AKI, versus small and lumpy in chronic disease. And they can show certain types of urinary stones.
Ultrasound gives more detail.
A lot more. You see the kidney's internal structure, size, shape, the texture, or echogenicity. The sources mention things like increased echogenicity in the cortex, that outer layer, suggesting things like antifreeze or inflammation.
Or rarely, decreased echogenicity in cats with lymphoma.
Exactly. But critically, ultrasound is the best way to look for obstruction. You can often see if the renal pelvis or the ureters are dilated, meaning urine is backing up.
Okay, diagnosis made. The sources are very clear. Treatment is intense. What does that involve?
It's usually intensive care. Hospitalization is almost always needed. The goals are basically fix the underlying cause if you can, stabilize the patient's immediate life threats, support the kidneys and give them a chance to heal, and manage all the complications.
What's the first thing, usually? Stabilization.
Fluid therapy. Aggressive FAV fluids are the cornerstone. Assuming the pet isn't already fluid overloaded, you're trying to rehydrate them, boost blood flow to the kidneys, and hopefully help flush out some toxins.
But you have to be careful not to give too much.
Absolutely critical. Fluid overload is a huge risk and can be fatal. The sources emphasize really close monitoring, weighing the pet multiple times a day, like 4 times daily, to catch weight gain from fluid retention. And placing a urinary catheter.
To measure urine output accurately.
Exactly. You need to know exactly how much urine is coming out to guide how much fluid can safely go in. It's a balancing act.
What about that scary high potassium hyperkalemia?
That's priority number 1 if it's present. It needs immediate action. The sources list several ways. Use fluids without potassium, like basic saline. Give diuretics like furosemide to help pee it out. Sodium bicarbonate can help. Insulin plus dextrose pushes potassium back into cells temporarily.
And calcium.
Calcium gluconate doesn't lower potassium, but it protects the heart from the effects of high potassium, buying you time to use the other methods. And if none of that works or it's severe,
Dialysis.
dialysis is the ultimate solution for refractory hyperkalemia.
What about just making them feel better? The vomiting, not eating.
Definitely manage those.
Yeah.
Strong anti-nausea meds like meropenem or ondansetron, stomach protectants like famotidine or sucralfate, and as soon as they can keep things down, nutrition is vital. Renal diets are preferred, maybe through a feeding tube if needed.
You mentioned the urinary catheter for monitoring. What if they just aren't making urine, even with fluids? Oliguria or anuria.
If they're properly hydrated and still not peeing much, you might try a diuretic like mannitol or furosemide to try and kickstart things. But, and this is really key in the sources, if a couple of doses don't work, they probably won't.
And continuing fluids then is dangerous.
Extremely dangerous. If there's truly no urine output, pouring more fluids in just leads to massive fluid overload, drowning them from the inside out. In that situation, fluids have to be cut way back, just enough to cover tiny losses.
And that's when dialysis becomes essential for survival.
Precisely. If medical management isn't working, the waste products keep climbing, electrolytes are out of control, fluid overload is happening, then renal replacement therapy, like hemodialysis or peritoneal dialysis, is often the only chance. It does the kidney's job, cleaning the blood, buying precious time for the kidneys themselves to potentially heal. The sources are clear. Many oliguric and uric pets simply won't make it without dialysis.
And if it was an obstruction causing it all?
Get it unblocked. Immediately. That's the priority. Usually means passing a urinary catheter for urethral blocks or surgery for ureteral stones or other physical blockages. And naturally, treating any specific cause found, like antibiotics for lepto or a kidney infection.
Looking ahead then, what do the sources say about the chances? What's the prognosis?
Overall, it's described as guarded to poor. One source mentioned an average survival rate around 50%, but that's just an average. It varies hugely.
Depends on what?
The cause is a massive factor. Something like leptospirosis or an obstruction, if caught early, might have a better outlook than, say, antifreeze poisoning, which is often fatal regardless of treatment. Severity also matters. Being oliguric or anuric is a worse sign, especially if dialysis isn't an option. How they respond to the initial treatment and whether they develop bad complications all play a role.
What are those major complications to worry about?
They're serious. We mentioned fluid overload that can cause fluid in the lungs, pulmonary edema, or around the lungs, pleural effusion. Those severe electrolyte problems, especially the life-threatening hyperkalemia, bleeding in the stomach or intestines, neurological issues like seizures or coma, and aspiration pneumonia if they vomit and inhale it.
And even if they pull through the acute crisis, is it over?
Not necessarily. This is another really important long-term point from the sources. There's a significant risk that they'll go on to develop chronic kidney disease. The acute hit might leave behind permanent damage, making them prone to CKD down the road.
See, follow-up is key.
Essential. Long-term monitoring and management are crucial, and the recovery itself, even getting back to baseline, can be really slow, weeks or even months.
Wow. Okay, this has been a really intense and honestly quite sobering deep dive into acute kidney injury, pulling directly from the materials you shared with us. It's obviously a very complex, very scary thing for any pet owner to face.
It really is.
But I think understanding these key things, the different types of causes, before, in, or after the kidney, recognizing those signs, even the confusing ones like peeing more sometimes, and just grasping how critical that immediate intensive treatment is.
Focusing on fluids, electrolytes, maybe dialysis.
Yeah, that knowledge feels powerful even if the situation is daunting.
Absolutely. Because recognizing those early signs or the risk factors might be the thing that gets a pet to the vet quickly enough for that aggressive treatment to have a chance.
It really makes you think about everyday things, doesn't it? Locking up the antifreeze securely, knowing which houseplants are dangerous for cats, making sure a sick pet doesn't get severely dehydrated, or just noticing if your dog or cat's peeing habits change.
Little things that could make a big difference.
And it really drives home that surviving the AKI episode isn't always the end of the journey. That potential for chronic kidney problems later means you need to stay vigilant. It leaves you wondering how much subtle kidney damage might go unnoticed after illnesses until it becomes a bigger problem years later. Something to keep in mind.
Definitely something to consider. Awareness is the first step.
Thank you again for sharing your sources for this really important deep dive.